HCR 240 Final Exam. A patient asks the nurse why they need to wear oxygen in the hospital and how it works with blood cells. Which is the best response? Blood cells passing through the arteries in the lungs are oxygenated and then carry oxygen to the body. When you take in a breath, the blood cells in your nose takes in the oxygen. The blood that pumps through the heart takes in oxygen. The blood receives oxygen from the bone marrow and carries it to the tissues. Blood cells passing through the arteries in the lungs are oxygenated and then carry oxygen to the body. How does severe hypoxia develop with pneumonia? Inflammatory exudate absorbs oxygen from the alveolar air. Infection reduces effective compensation by the heart. Acidosis depresses respirations. Oxygen diffusion is impaired by the congestion. Oxygen diffusion is impaired by the congestion. The nurse is discussing with the student nurse a pulse oxygenation measurement. The student nurse knows what measurement is acceptable for a pulse oxygenation reading in a healthy adult. 92 95% 89 92% 97 100% 90 93%. 97 to 100%. What causes the expanded anteroposterior (AP) thoracic diameter barrel chest in patients with emphysema? Persistent coughing to remove mucus, recurrent damage to lung tissues, dilated bronchi and increased mucus secretions, air trapping and hyperinflation. Air trapping and hyperinflation. What is an early sign of lung cancer? Weight loss, chronic cough, air trapping and overinflation of the lung, bone pain. Chronic cough. Which of the following describes lobar pneumonia? Sudden onset fever and chills with crackles and rusty sputum. Insidious onset, diffuse interstitial infection. Opportunistic bacteria causing low-grade fever with cough and thick greenish sputum. Viral infection causing non-productive cough and pleuric pain. Sudden onset fever and chills with crackles and rusty sputum. One of the functions of the pulmonary system is the principal mechanism for cooling the heart. Exchange of gases between the environment and blood. Movement of blood into and out of the capillaries. Expelling of bacteria. Exchange of gases between the environment and blood. A 10-year-old develops pneumonia. Physical exam reveals subcostal and intercostal retractions. The child reports that breathing is difficult with feelings that I cannot get enough air. What term should the nurse use to document this condition? Cyanosis, hyperpnea, orthopnea, dyspnea. Dyspnea. A 65-year-old diagnosed with emphysema presents to the ER for difficulty breathing. Physical exam reveals both bluish skin and mucous membranes. What term will the nurse use to document these observations? Hemoptysis, hematmesis, ischemia, cyanosis. Cyanosis. A 50-year-old presents with hypertension, hypoxemia, and tracheal deviation to the left. Tests reveal that the air pressure in the pleural cavity exceeds barometric pressure in the atmosphere. Based upon these assessment findings, what does the nurse suspect the patient is experiencing? Open pneumothorax, pleural effusion, tension pneumothorax, transudative pneumothorax. Tension pneumothorax. What assessment findings will the nurse observe in a patient diagnosed with severe pulmonary edema? Pink, frothy sputum, thick mucus secretions, hypocapnia, wheezing. Pink, frothy sputum. A 42-year-old presents with dyspnea, rapid shallow breathing, inspiratory crackles, decreased lung compliance, and hypoxemia. Tests reveal a fulminant form of respiratory failure characterized by acute lung inflammation and diffuse alveolo-capillary injury. What is the most likely diagnosis supported by the patient's condition? Sarcoidosis, acute respiratory distress syndrome, ARDS, malignant respiratory failure, postoperative respiratory failure. Acute respiratory distress syndrome, ARDS. Pneumonia is caused by chronic lung changes seen with aging, atelectasis, viral or bacterial infection, use of anesthetic agents in surgery. Viral or bacterial infection. The incidence of fractures of the pelvis is highest in adolescent boys, adolescent girls, older adults, pre-adolescent boys. Older adults. A 70-year-old female presents with a hip fracture secondary to osteoporosis. This condition is caused by an increase in bone formation, resorption, density, mineralization. Resorption. A 56-year-old male was admitted to the hospital with a diagnosis of osteomalacia. History reveals that he underwent bariatric surgery 3 years earlier. What is the common link between the surgery and the development of osteomalacia? Impaired vitamin C metabolism, impaired phosphate absorption, vitamin D deficiency, increased calcium secretion. Vitamin D deficiency. Osteoarthritis, a degenerative joint disease, is characterized by loss of articular cartilage, the epiphysis, synovial fluid, the joint capsule. Articular cartilage. Researchers now believe that rheumatoid arthritis, RA, is a result of an autoimmune disease, a superficial joint injury, a complication of rheumatic fever, an ineffective antiviral agent. An autoimmune disease. Which of the following people is at highest risk for the development of gout? Female children, male adolescents, premenopausal women, men aged 40 to 50 years old. Men aged 40 to 50 years old. Fibromyalgia is a chronic musculoskeletal disorder characterized by diffuse pain, fatigue, and tender points, pain resulting from joint and muscle inflammation, neurologic pain in the skeletal muscles, muscle pain in the back, and gastrointestinal symptoms. Diffuse pain, fatigue, and tender points. What clinical finding would be expected in the patient with rhabdomyolysis? Sweating, dark urine, yellow color to the skin, lower extremity swelling. Dark urine. What is the primary organism responsible for osteomyelitis? Salmonella, Mycobacterium, Staphylococcus aureus, Haemophilus influenza. Staphylococcus aureus. A disorder similar to osteomalacia that occurring growing bones of children is termed osteosarcoma, rickets, osteomyelitis, Paget disease. Rickets. A 34-year-old female was recently diagnosed with rheumatoid arthritis, RA. Physical examination revealed that inflammation is noted in various bursy sac, short bone, synovial membrane, subchondral bones. Synovial membranes. The cause of Paget disease is osteogenic fluoride deficiency, excess vitamin A, unknown at present. Unknown at present. A patient with chronic kidney disease is very weak due to low hemoglobin. What should the nurse understand as the best explanation for the anemia? Secretion of erythropoietin by the diseased kidney is reduced. Select the patients who are at the greatest risk of developing iron deficiency anemia. Select all that apply. A 25-year-old female who was recently diagnosed with celiac disease. A 35-year-old female who is 36 weeks pregnant that reports craving ice. The physician orders a patient with suspected iron deficiency anemia a blood smear test to assess the quality of the red blood cells. How would the red blood cells appear if the patient had iron deficiency anemia? Hypochromic, microcytic. The nurse is providing education to a patient about how to take their prescribed iron supplement. Which statement by the patient requires re-education? I will avoid taking this medication with orange juice. True or false, the body uses hemoglobin to make iron? False. True or false, high levels of iron lead to the body producing fewer red blood cells? False. True or false, early signs and symptoms of iron deficiency are difficult and hard to detect? False. A patient with chronic kidney disease is very weak due to low hemoglobin. What should the nurse understand as the best explanation for the anemia? Secretion of erythropoietin by the diseased kidney is reduced. Select the patients who are at the greatest risk for developing iron deficiency anemia. Select all that apply. A 25-year-old female who was recently diagnosed with celiac disease. A 35-year-old female who is 36 weeks pregnant that reports craving ice. The physician orders a patient with suspected iron deficiency anemia a blood smear test to assess the quality of the red blood cells. How would the red blood cells appear if the patient had iron deficiency anemia? Hypochromic, light/pink, and microcytic, small. True or false? The most common type of anemia is iron deficiency anemia. True. The nurse is providing discharge teaching to a patient about pernicious anemia. Which statements by the patient indicates they understand the discharge teaching? A red smooth tongue can be a sign of pernicious anemia. Treatment for pernicious anemia includes a series of intramuscular injections of vitamin B12. Pernicious anemia causes the red blood cells to appear very large and oval. True or false? Intrinsic factor in a protein that plays a role in how the body absorbs vitamin B12. True. For a client diagnosed with aplastic anemia, which changes should the nurse be monitoring for? Bleeding tendencies. Which of the following disorders results from a deficiency of factor VIII? Hemophilia A. The nurse explains to the parents of a 1-year-old child admitted to the hospital in sickle cell crisis that the local tissue damage the child has on admission is caused by which of the following? Obstruction to circulation. The client with cancer is receiving chemotherapy and develops thrombocytopenia. The nurse identifies which intervention as the highest priority in the nursing plan of care. Monitoring and platelet count. A client is diagnosed with multiple myeloma. The client asks the nurse about the diagnosis. The nurse bases the response on which of the following descriptions of this disorder? Malignant proliferation of plasma cells and tumors within the bone. What are the components of an EKG complex? PQRST. True or false? CO equals HRXSV. True. What is the correct blood flow through the heart? RARV PAPV LV. Which patients are most at risk for developing coronary artery disease? A 35-year-old male with a BMI of 30 and reports smoking 2 packs of cigarettes. A 29-year-old that has type 1 diabetes. A 45-year-old female that reports her father died at the age of 42 from myocardial infarction. What is/are the cause of venous thrombosis? Stasis of blood-altered blood coagulation vessel wall injury. A client is admitted with a venous stasis leg ulcer. A nurse assessed the ulcer. What finding should the nurse anticipate? Has brown pigmentation around it. In preparation for discharge of a client with arterial insufficiency and Raynaud's disease, the nurse should include what teaching? Keep the heat up so that the environment is warm. Which patients are at risk of developing hypertension? A 40-year-old female with a family history of hypertension and diabetes. A 25-year-old obese male. A 68-year-old male who smokes 2 packs of cigarettes a day. Which body systems are affected by uncontrolled hypertension? Brain, respiratory, kidney, and cardiovascular. Cardiovascular, brain, kidneys, eyes. Cardiovascular, gastrointestinal, reproductive, and kidneys. Which symptom usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? Lower back pain. A patient diagnosed with Guillain-Barré syndrome, GBS, asks how the disease developed since the patient rarely has an illness. What nursing response is the most accurate? It may be an autoimmune reaction to a virus. A patient is incontinent during a seizure and sleeps for several hours afterward. What type of seizure did the patient most likely experience? Tonic-clonic. A patient is recovering from an epidural bleed. In which part of the brain should the nurse explain to the family that this bleed occurred? Space between the dura and the skull. A patient is unable to move the extremities after experiencing a spinal cord injury. What term should the nurse use to document paralysis of all four extremities? Quadriplegia. A patient with a cerebral injury is experiencing increased intracranial pressure, ICP. Which intervention should the nurse use to help prevent further increasing intracranial pressure? Space nursing care at intervals so that necessary care is distributed evenly throughout a shift. A patient with amyotrophic lateral sclerosis has difficulty swallowing and copious pulmonary secretions. What equipment should the nurse ensure is at the bedside at all times? Suction. A patient with a spinal cord injury is unable to move the extremities. In which area should the nurse suspect that this client's injury occurred? C4-C8. The nurse is assisting with teaching family members about a patient's epidural bleed. Which information about an epidural bleed should guide the nurse's teaching? It is usually arterial and may lead to death without rapid intervention. The nurse is caring for a patient brought to the emergency department after an automobile accident. The patient is fully conscious. For what early signs of increased intracranial pressure, ICP, should the nurse be alert? Decreased level of consciousness. The nurse is caring for a patient who has had Parkinson's disease for 15 years. What symptoms should the nurse anticipate when assisting with a routine assessment? Slow shuffling gait, difficulty swallowing, and pill-rolling tremor. The nurse is caring for residents on an Alzheimer's unit. Which assessment finding indicates that a patient is in early stages of the disease? Forgetfulness. The nurse is caring for a patient experiencing an acute exacerbation of multiple sclerosis, MS. Which pathophysiological change should the nurse recognize as causing the manifestations of MS? Demyelination and destruction of nerve fibers. The nurse suspects a patient with a spinal cord injury is experiencing spinal shock. What did the nurse assess to come to this conclusion? Flaccid paralysis and lack of sensation below the level of the injury. A 19-year-old patient reports flank pain and scanty urination. The nurse notices periorbital edema, and the urinalysis reveals white blood cells, red blood cells, albumin, and casts. What question would be most important for the nurse to include in data collection? Have you had a strep infection of the throat or skin recently? A patient hospitalized for orthopedic surgery had a urinary catheter inserted. The patient later develops a urinary tract infection, UTI, and asks the nurse what caused it. What is the appropriate response by the nurse? Bacteria probably ascended the catheter, causing the infection. A patient hourly urine output is recorded. Which output rates should be brought to the attention of the registered nurse, RN, immediately? 15 ml/HR. A patient with glomerulonephritis develops acute kidney injury. Which form of kidney injury should the nurse realize has occurred with this patient? Intrarenal. The nurse is caring for a patient who has renal calculi. Which action is essential for the nurse to take? Strain all urine. The nurse is caring for a patient with an acid-base imbalance from kidney disease. How should the nurse explain the role of the kidneys to maintain acid-base balance in the body to the patient? Conserving or excreting bicarbonate ions. The nurse is collecting data from a patient with suspected cancer of the bladder. What finding should the nurse recognize as the most common symptom of cancer of the bladder? Hematuria. The nurse is collecting data from a patient who has returned from a dialysis session. After dialysis, the nurse should anticipate which patient finding. Weight loss. The nurse is collecting data from a patient with stress incontinence. Which finding should the nurse document? The patient loses small amounts of urine when he or she coughs or sneezes. The nurse is reinforcing teaching provided to a patient about antibiotics prescribed for a UTI. Which patient's statement indicates teaching has been effective? I will take the antibiotics until they are gone regardless of symptoms. The nurse is reinforcing teaching provided to a patient about risk factors for prerenal injury. Which risk factor should the patient state that indicates understanding of this teaching? Adequate fluid intake. The nurse is reviewing the history and physical of a patient who has an infection. What term should the nurse realize describes an infection of the kidneys? Pyelonephritis. A patient develops hyperparathyroidism related to a benign tumor. What laboratory result should the nurse expect to see? Elevated serum calcium. A patient has a disorder affecting the anterior pituitary gland. Which hormone should the nurse expect to be affected in this patient? Adrenocorticotropic hormone. A patient is having a thyrotropin-releasing hormone, TRH, stimulation test. After injection of TRH, what response should the nurse expect in a patient with normal thyroid function? Elevated T3 and T4. A patient is newly diagnosed with type 1 diabetes mellitus. How should the nurse respond when the patient asks how long insulin injections will be necessary? You will need insulin injections for the rest of your life. A patient with type 1 diabetes mellitus asks what caused the fruity odor that was present at diagnosis. How should the nurse respond? In the absence of available sugar, the body breaks down fat into ketones, which have a fruity odor. The nurse is caring for a patient with lung cancer who develops syndrome of inappropriate antidiuretic hormone, SIAD, secretion. Which assessment findings should the nurse expect? Weight gain and concentrated urine. The nurse is planning care for a patient with diabetes insipidus. What data should the nurse to monitor this patient? Intake and output and daily weight. The nurse is reviewing the causes for the development of type 1 diabetes mellitus with a patient who is newly diagnosed with the disorder. What major factor in the development of this disease should the nurse include? An autoimmune response. The nurse is reviewing the regulation of blood glucose level for a patient with type 2 diabetes mellitus. Which two hormones should the nurse explain work in opposition to regulate the blood? Insulin and glucagon. The nurse is reviewing the treatment of type 1 diabetes mellitus with a patient newly diagnosed with the disorder. Which hormone should the nurse explain lowers the blood glucose level by enabling cells to take in glucose? Insulin. Which endocrine organ is located in the brain? Hypothalamus. Which of the following hormones is not released from the adrenal gland? Adrenocorticotropic hormone, ACTH. The nurse is teaching a male client to perform monthly testicular self-examinations. Which points would be appropriate to make? Testicular cancer is a highly curable type of cancer. Which of the following is the location where fertilization occurs? Fallopian tubes. Which of these is the most common warning sign of uterine, endometrial, cancer? Abnormal vaginal bleeding. Which of these is commonly the first symptom of ovarian cancer? Abdominal bloating. A female client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites for cancer cells? Liver. The nurse is instructing a premenopausal woman about breast self-examination. When should the nurse tell the client to do her self-examination? Immediately after her menstrual period. An oncology nurse educator is speaking to a women's group about breast cancer. Questions and comments from the audience reveal a misunderstanding of some aspects of the disease. Various members of the audience have made all of the following statements. Which one is accurate? Men can develop breast cancer. True or false? Prostatitis can be caused by sexually transmitted diseases. True. True or false? Benign prostatic hypertrophy of the prostate gland is caused by cancer. False. A patient recovering from a thyroidectomy is being assessed for tetany. What is the most likely cause of tetany after this surgery? Excess circulating thyroid hormone released during manipulation of the gland during surgery. A female client is being treated for genital herpes. What should be included in the patient teaching? Prevention of outbreaks of lesions. The nurse should include which of the following questions in a nursing history from a client admitted with pelvic inflammatory disease, PID? Have you ever used an intrauterine device? A female client has just been diagnosed with condylomata acuminata, genital warts. What information is appropriate to tell this client? Select all that apply. This condition puts her at higher risk for cervical cancer. She should have a Papa Nicolau, PAP, smear annually. The potential for transmission to her sexual partner is lessened if condoms are used every time they have sexual intercourse. The most common treatment is an antifungal medication which should eradicate the problem within 7 to 10 days.